So Sam, Barbary, do you want to ask your question, unmute yourself and ask your question?
Yes, I'd love to hear some ideas on sort of 2-3 of the most exciting things that you guys are seeing in terms of AI specifically in health and med tech.
Anthony, do you want to take that one?
Sure. I think right now, I think AI and healthcare are mainly in 3 different areas. One is image interpretation. A few of those companies have done well. I think this.ai just recently got approval for reimbursement, so that's a good precedent. There are other exciting companies in that space. Zebra from Israel, I think, is doing some really good innovative ways of looking at medical imaging. A second area I think that's important is decision support, and in a myriad of ways of doing that, from the OR to front lines and even COVID. I think one of the companies I like is Javion. It's doing some good innovative decision support work with a emphasis on return on the investment and sort of value proposition for AI, which is sometimes not easy to show. And I think a third big area that's really exponentially increasing in presence as well as investments is the whole area of automating healthcare, particularly using robotic process automation. One of the companies that I also like is Olive, that's really making a lot of big investments into taking over the entire health system in terms of automating processes that really should be automated in terms of reducing manpower needs, as well as increasing accuracy and speed of transactions. So those 3 areas I think are pretty robust areas right now. There are other emerging areas, but I think those 3 are probably the biggest areas.
Would you lump remote monitoring into the second category?
Yeah, remote monitoring with or without AI?
With.
Okay, yeah, I think that's going to be, I'm actually exploring that area myself clinically because of the number of patients I'm following now without clinical action. Yeah, I think absolutely. Any kind of embedded AI is going to be big the next few years.
So we're confronting several realities. One is the ever-changing regulatory and compliance environment, most recently CARES and interoperability mandates and providing patients with information and all that. The other is it's virtually, well, it is impossible to put all the information in one place, in the data. I mean, we all know how much this thing is growing in zettabytes and whatever next byte are. There's just questionable, where do you put all this stuff? And then the third point has to do with interoperability and how do you connect the dots so that you have the information or the data that you need to do in this instance, for example, AI analysis, transformation, delivery, display, et cetera. So will those things drive, in your opinion, and I guess I could ask Eric, Anthony, or anybody else, the dissemination and implementation of platforms or products that are designed to rethink, for lack of a better term, the EMR or the cyber, what I call the cyber nervous system. I mean, what is the brain of the cyber nervous system going to look like, given the realities that I just mentioned? Anthony, do you have any thoughts on that?
Yeah. I think what's holding back from more robust aspects of AI is the fact that the healthcare system is very fragmented and inadequate in the area of data, not just image data, but any kind of data to really, I think, benefit greatly from AI. And I think there are companies getting into the space of being the convener of data sources or curating the data even. So, because I think if you read the book called Prediction Machines, if you haven't, it's a really good read on AI and economics in general. So maybe this group particularly would be interested in that book. It's by a trio of people from Toronto. Had the pleasure of meeting two of the three authors, but they really do a good job of explaining the economics of AI in terms of making predictions very cheap and very available. I think the one caveat there is in healthcare, though, they didn't mention that what's really driving that entire sort of sequence is going to be data. So if you don't have a lot of data, it really could set you back in terms.
Your microphone is muted.
I was just saying that if you don't have enough data, it makes the prediction a little less reliable and a little less easy to do because in healthcare, it's different than prediction machine economics in the sense that you kind of need the data as the substrate to drive your economics, and that wasn't particularly mentioned in the book. So there are companies, as I said, doing curation of data, convening data. I think it's a difficult space because of how fragmented healthcare is, particularly in this country, in the US. But you do see more and more activity now just dealing with data alone, not the AI part.
Roger, do you want to ask your question? Roger Austin.
Thank you. So my question is, will this...
excuse me, Roger, can you introduce yourself and tell us who you are?
Okay, my name is Roger Austin. I'm a PA in North Carolina, and thank you for hosting this. So my
Thanks for joining us.
Go
ahead.
Question is, will this brain that the healthcare system needs, will it just be produced, or will it evolve along with the changing health system itself? Thank you.
So I'll start off. So I see this, I call this actually cyber brain embryology. It's a term, it's a kind of cute little term that addresses your issue. And how will the cyber brain, so the construct is, it's like the cyber nervous system, in my view, is like the human central nervous system. That is, there are end organ receptors, proprioception, touch, pain, feel, the ones we know, that send afferent signals to the brain. And then the brain miraculously translates that into a motor nerve signal or some other autonomic signal or endocrine signal that goes to an end organ, which is an efferent signal. Afferent to the brain, efferent away from the brain. And then it goes to an end organ where there's an end organ response through, in the case of muscles, a neuromuscular junction. So if you use, and the, you know, the similarity, for example, the example is you put your hand on a stove and instantaneously all that happens and your brain tells you to move your hand away. Well, that feedback loop and that system is what I call, if you translate that into the cyber world, and I'm talking the world, I'm not just talking Denver or LA or Charlotte, the world. So if you're creating a world cyber nervous system that takes afferent information to a brain, unquote, or a single source of truth, whatever that looks like, and then that brain translates all that into an efferent signal, which is designed to do two things. One, to provide the information necessary to make a decision, or two, to provide the information necessary to change behavior. Now, if you accept that paradigm, and that's just mine, I'm interested in what everybody else thinks. My view is that today, about 90% of the activity going on in AI and in IT brain embryology is about afferent, accumulating data, remote sensing, patient-reported outcomes, Fitbit, stuff you enter into an EMR, da-da-da-da-da-da. And thanks to folks like Anthony, the brain part of all of this is gradually developing. I mean, you can make the argument that right now we sort of have a lizard brain or whatever. We're evolving the neocortex of the cyber brain, okay? The efferent part, I think, is the most difficult, and that's why it's lagging. In other words, how do you use this to change behavior? And that is, to me, the most difficult of patients and doctors and the other stakeholders, because without changing behavior, it's unlikely, in my view, A, the system's going to get any better, that is sick care into healthcare, or you're going to see an ROI just from a purely pragmatic administrative and business perspective. So I think this system is, so to be specific to answer your question, it will evolve just like the human brain evolved to adapt to environmental stimuli. I mean, that is the point of the human central nervous system, to sense the environment and protect and respond us from it and respond to it. So I think the same thing is going to happen with, now, whether any of us will be around to see that, who knows? But hopefully the people on this call will make it happen. So I'm interested to hear what other perspectives.
Yeah, I totally agree that efferent is what we need to work on. And I don't think you may or may not know about this, Arlen, but in pediatrics, there are 500 pediatric hospitals around the world, and we're actually working on a way to interconnect all the devices, particularly diagnostic devices, so that you have a central repository of data and information. And I think that would be very exciting. It's similar to, remember when the internet had just started, it wasn't until we hit about 1 million devices that we have something really, really significant. It was kind of exponential in terms of the dividend. So we're hoping that if we get to 500,000 devices, then it makes research, the traditional clinical research, not obsolete, but certainly outdated, because all the information will be gathered in a central repository, then analytics can be done in that repository, and the information given back to all the centers. And I think that's what we're going to need to really put medicine into the next century.